Thanks for staying with us. A viral video has sparked widespread attention, showcasing a nurse who was being bullied and recorded by her colleagues for not joining the nationwide strike by the National Association of Nigerian Nurses and Midwives. The nurse was subjected to verbal abuse and derogatory remarks, including being called a saboteur. Despite the strike suspension, the incident highlights the challenges faced by healthcare professionals in Nigeria. The nurses' dedication to saving lives has earned praise from some, while others have criticized the union's action. Singer Inyanya also offered the nurse a 500,000 naira reward for her commitment. The incident has sparked heated debate on social media, with many defending the nurses' right to prioritize patient care. The strike has also sparked disputes over poor working conditions and unpaid allowances. The nurses' bravery in standing up for her values has inspired many to speak out against bullying and harassment. Others have said that she should have joined the collective mission of the organization, the association, for the collective objective. Because it's one thing to have a personal ambition, it's another thing to have a collective ambition. What are your thoughts on this? You can join the conversation and call us on 090-241-63440. You can also send us messages on X and also on YouTube. We'll be happy to share your thoughts. So there are two sides of the story. Looking at it at face value, oh, she's there because she cares for people, she loves people, that's why she decided to come to work. But others will say, for a greater good, for a greater objective, it's important that you join the strike. Because if you keep working, governments would not adhere to what they have said they would do. So there are two sides of that story, and I'd like to hear your thoughts. Do you agree with her coming to work, or do you think she should have sacrificed, as others have, her work, so that for the collective objective?
Our stories are different.
Okay.
And our experiences and our story influences what we do. If you've ever had your health and your life threatened based on lack of medical personnel, you probably will not react the same way others will. You won't look at it as naira and kobo. If you've lost someone close to you based on the fact that the person wasn't treated because medical personnel were on strike, your reaction will be different. So I watched the video and my first thought was, solidarity forever. And I looked at the woman and I'm like, it's only her that knows what she's gone through or what family members that she's been through have gone through to make her decide that even though I know they would crucify me and shout at me, I will show up there to prevent any life from being lost. And for the greater good, I respect her for the sacrifice she's made. Her single activity is not going to jeopardize the strike. It won't jeopardize the effect of the strike, because really, one or two people showing up from hundreds of people that were supposed to be there will not make any huge difference, but it might save a life. It might not make a huge difference in the quality of healthcare the hospital will give, but it might just be what will save one life. I remember when someone in my husband's office was, he was depressed, he took sniper, were rushed to the hospital. It was a life and death situation. It was a case of if there was 5 minutes delay, gone. 5 minutes delay, gone. So the ability to provide that life and death rescue, some people might look at it and say, we will die if we continue to provide life and death rescue and the government does not answer us. And somebody who has lost someone will probably react. I can't wait to hear this woman's story. I feel she has a personal story of loss based on something like this, which is why she was willing to go that way. So a part of me is willing to forgive her for not joining the solidarity.
Yeah, so when I watched the video, the first thing that came to my mind, she just reminds me of my secondary school matron. She was not even answering them as they were there videoing. She was just still locking, putting her locker in place and moving and everything. I really commend her. And there are some sectors in the country that are not even supposed to be on strike. They are not even, that S is not even supposed to start in the first place. That's just the truth. Because before even the strike will happen, they will have mentioned this is what's the problem. They will have tabled all their issues and everything. And these are issues that are supposed to have been resolved a long time ago. Now, the Minister of Health is there. It's not just the Minister of Health. We have all the commissioners. I don't want us to even call on the president and start blaming the president. Let's let's hold people who are responsible accountable. Some sectors are not just supposed to be going on strike. We don't have to go on strike for the government to listen to us at all times. Sometimes there are better ways we can go about all these things without going on strike, because if this strike continues, there are a lot of people that die. I saw in comment section when people were making comments, a lot of people, someone even said that I'm a survivor, like he survived, if not, he was sick and he was on strike, but he was able to survive because one nurse or one doctor came on call that day and treated him. So you can imagine how many people, we don't even talk about after the strike, after they must have resolved all the issues, we don't even talk about the people that have died or the loss and everything that will have happened and everything. So in the first place, please, let's rule out some sectors. We don't need to go on strike. Okay,
Nima, what are your thoughts on this?
You cannot make somebody's profession a thing of punishment. I don't know whether our policymakers think about the psychological effect of what a strike is for people in this sector. So they're not just civil servants in the ministries that, you know, are signing papers. They have to render a health service. And most of it are compassionate jobs. They must be passionate, they must, you know, deploy empathy. So for you to be able to strike as a medical doctor or a nurse in a public hospital, it means that you'll be able to close your eyes and look at a dying person and walk away. Psychologically, we are destroying a lot of people. We cannot allow this conflict of profession group abuse, labor group of their labor angle and their duty to serve.
It numbs them over time.
Yes. We are mothering that humanity in them. Over time.
By our selflessness.
It starts from one and then
selfishness towards them.
Then you know, to balance it, there will be the thought process of saying, I could now even afford my daughter's school fees. Whereas this job is one that your loved ones, your family members know that once you take it, that person is in your iluni, belongs to the community. Yes. Such a person in that profession belongs to the community. Imagine those nurses when we're little. If you're watching, the matrons who worked in the general hospitals, well, our parents did not have to take us there. They knew us. I just used to walk and say, I have cramps. She would say, and they should give me something for my period. They were our family members. Those people, their houses were not private homes. They were public houses. All of them, we used to crowd their houses for free medical care. So imagine them having to work in a government hospital and seeing somebody in that state, even worse states, in labor, somebody dying and having to turn their back because there's a strike. To rationalize it, the process itself can kill somebody. And we put them continuously in that position because I don't know why NMA would write, the Nurses Society would write, or whatever would write government, and we'll read it in the papers 3 weeks, 5 weeks after.
Yeah.
They now go on the warning strike.
And nothing happened.
So at this point, you engage them immediately because we don't need the monsters that these strikes create, especially in this sector.
I hear you. And I think for me, I also blame the system so much because strike is a part of life. Everywhere in the world, they strike. I mean, I remember that I was in the UK when there was transportation strike, right? But now, when that happens, there's a system around it. Striking means that, okay, you will not get your trains every 5 minutes. It will come maybe once in the hour or once every 2 hours.
So it's not like they shut it down.
They don't shut it down totally because there's a system around how to strike. The same way with the hospitals. Yes, when we strike, to go to the point where, okay, instead of 10 nurses on duty, there's only 2 nurses because we are on strike. There's got to be a system around it because that's what I like what you said about it numbs you because there's no humanity. If you just do a strike where it's total shutdown, that is you being totally insensitive to the effect of that total shutdown.
It grows over time,
because even total shutdown, the problem with Nigerian shutdown is that if we don't totally shut down, government will not respond.
Yeah, so it's the government that numbs you over time. Because you would do partial one, they will not answer you. You will do full one, they will not answer you. Look at the story I took of Lautech today. Lautech is asking, pay us, you are paying other medical services within Oyo State the new minimum wage. Pay Lautech medical officials as well now. Recruit more doctors for us. We need doctors. They said since January, they announced. They went on strike. 1 month. They resumed that, okay, let's give you time. They gave 3 months. Then they did notice 3 weeks. Then no response until. So what it's not for lack of trying. So because like Nima mentioned earlier, it's as if we punish medical personnel. Like we punish medical personnel that if you don't do your job, if people die, they will blame you. They won't blame the governor. They will blame the nurse that, you feel bad. Because imagine if you've been treating someone for weeks and then you now have to stop treating that person because they've called strike. There's a level of heartlessness that you're expecting people to have, and you are expecting them to have, and everybody saying we must do it, because if not, our own children too will die. They will not go to hospital and all of that. So we are appealing this appeal, this video. Yes, I'm happy, Yanya. Did you mention it?
Yes,
Yanya gave the money we're giving to that particular nurse, but that's just trying to. It's just one.
I need to go on
a bigger issue.
I need to go on a brief, because I'd like us to touch on the fact that she was being bullied. Even if you're not happy.
They were picketing.
Let's go on a short break. When we come back, we'll continue with this conversation. Stay with us, we'll be right back. Thanks for staying with us. All right, so we're discussing the nurses who were verbally abusing and harassing their colleague. Nima said they were picketing. Yes, picketing, you go there to come and say we're on strike. But when you now start deliberately harassing a colleague, you've gone past picketing to bullying. So what we saw in that video was beyond picketing.
It's shaming. And it was so to compel compliance. So we have already gone on this industrial action. All of us agree. That's the problem of when you have a body.
But recording her and calling her name was not necessary. You tell your colleague to go and meet her.
You know that it's possible it's possible. I don't know, this is not... but it's possible that she was rendering this service not because she was compassionate.
Okay.
But because, you know what we see in
different reasons, yes.
That somebody can say, okay, I will pay you. She'll say, okay, don't worry, I will find a way.
Exactly.
So one of the ways that I believe that when these strikes happen in the government hospitals, there are things I have benefited using government hospitals. When government hospitals that I go to strike, I won't go out when I come there and they're on strike. I will wait around till I see one nurse and say, this is the condition of the baby that I brought. They'll tell me, okay, go and buy this and this and this, and self-medicate. So it's almost as if I've seen a doctor, but I just didn't run the lab test. I will say the symptoms, they will give me some solutions, I will walk away. So those are some of the things I believe that they can generalize. You can refuse to touch the patient, let the patient tell you what their symptoms are. Because it's just something that, it takes out, you have to have the liver to be able to turn your back on somebody in need. And your profession is not one that allows you. I think that communication is something they can do. And if all of them were doing it, they will understand what she was doing. It will not be that they are assuming. But somebody has to compel compliance. To shame her to video it is for most likely the members of the association.
Others.
Any one of you we meet in the hospital trying this nonsense, this is what you will go through. And you see most of them say, one ball, those days in LASU, when they go on strike, it's the NASU people that do it the most. They used to come with Pankere. If they meet you in the office, the meeting, and they will record it. Are you
serious?
Even with that, we say, no, you carry your ID card, students, because you don't want it. But they took any measure to ensure that their voices were heard. And a lot of things changed for them. So
there's that thin line between being a team player and then your personal, because there's compassionate reasons, as Nima said, and there could be just professional reasons.
So there are witnesses. I have a staff who is a Jehovah's Witness member, and I know that there are things they are not allowed to do. Jehovah's Witness members don't vote. Jehovah's Witness members don't go on strike. They don't take blood transfusion based on their religion. Yeah. That's their belief. That's what that's the rule that binds them. So if you, by your beliefs, by your faith, are not allowed to do something and they declare it publicly, you will stay there and not do it.
You stay in your house?
Or no, you can't stay in your house, because that already means that you are involved in the strike. So there are, for many reasons, people can decide to do it. It doesn't necessarily mean that my standing my ground does not mean I am fighting you. You see, those nurses that were videoing and fighting the woman, they felt like her position was compromising them, and it may not necessarily be that. We should give room, and I'm all for, like I said, solidarity forever. I'm all for let's do this, let's all bond together and achieve our goals, but we must give room for those who, for religious reasons, or maybe for personal reasons of I have lost someone in a strike. I can't sit down in my house and say I am on strike and I watch other people lose loved ones because of this. There must be that room. And most importantly, the insults they are insulting that woman, let the nurses insult the government. Insult the commissioners that did not answer you. Focus on the real, and the people that are your real enemy. They are the ones that did not answer you. Focus on them. Your fellow nurse is not your enemy. The nurse is dealing with the same issues you are dealing with. They just did not join the strike for whatever reason personal to them. Let us point towards the right. So sometimes we're so angry with the system that we fight each other. We are fighting. Sometimes police will stop me. I'll be like, Oga, rice is expensive. You and I are buying the same rice. I'm not your problem. Like, you have gone to Empire. I'm not the problem. Oh. The people that are the real problem, let us face them. Oh. It's like when the NSAS issue happened and they came to attack us. We're like, we are all together. But it's no longer, we get to a point where we're so angry that we no longer see ourselves as human beings facing the same thing, bleeding the same red blood. We start fighting each other instead of fighting the system that is causing the problem.
Yeah, so I think she knows what she was doing, because even as the way they were accusing her and talking, she didn't even respond. She didn't say anything to them, which is very,
she's wrong
mature.
And at the end of the day,
she's wrong for being there. That's why she kept quiet.
At least now they can see that they need to find other ways, because they can see that the public, they are even supporting her more. Because from everything I've seen, yes, I've seen that a lot of people are even, so to the extent that, look at now, she got a cash reward. So I'm very sure they will go inside and look inwards and then start and look for other ways of how they
government.
Why? Say that's a wicked laugh. Who is going to go inside and
look inwards?
Look inwards.
We have to.
Have you seen anyone else?
Because you know,
so this,
at the end of the day, it's the
most
masses that will suffer.
No, this is what
they will suffer this thing.
This is what will most likely happen. In fact, superiors were among those people that came there, and they see that she can collect 500,000. That 500,000 will come out of some of our entitlements in service when they call up this strike. They will show up.
We'll go wicked. I can imagine never been our guy.
Nima is solidarity.
That we solidarity about. You don't let them give us bad name. Because see, that's the position. See, for me, yes, as Tokwe said, we need to, our politicians and policymakers need to understand that you put our people at this point where, you know, they are against each other. But it's also difficult, it's also dangerous to tell them that we are together and we face the government. Government should be thinking ahead like this and finding solutions. Please take your call.
Let me take Bolaji from Ikorodu. Thanks for calling. You're live. Good morning, Bolaji. Morning. Yes, go ahead. Go ahead, sir.
Yeah, can you hear me?
Very clearly. Go ahead.
All right, good morning.
Morning.
This is my first time calling in.
Welcome to the show.
Thank you. I really appreciate what you guys are doing, and you're doing a fantastic job. I'm just calling in because of this particular issue of this nurse. She's really showing how patriotic Nigeria should be, actually. Because actually, you see, there are a lot of things going on in this country that we need to really talk about. We must first of all see ourselves as Nigerian humans before we see ourselves as maybe I'm a nurse, I'm a doctor, I'm a police. These are essential sectors that no matter the condition, no matter what is happening there, are not supposed to even think of going on strike, let alone saying you're on strike. Just imagine people dying. We don't even value lives in this country anymore. We see dead people on the road, and we just see it as normal thing. And if you look at it, this is what is really killing our morals in this country. When we don't value life, when we don't really value life, we just live as animals. These are not animals dying on the street. These are human beings. It's when we start valuing life that we start seeing ourselves as something that, you know, are God-given. How can you say nurses should go on strike when people are in the hospital dying? We don't even have enough medical.
Thank you, Bolaji. But Bolaji, do you know that some people striked years ago to get us to the point of where we are today? Striking, as I said before, is a part of life. In the 60s, you were not there. In the 40s, you were not there. There are strike actions across various parastatals that led to the fact that you even have a hospital today in certain places. So striking is part of what we need to do to demand. Is a right and is recognized in our constitution. So the point is that whether we like it or not, nurses will strike and they will continue to strike. What we are saying is that we have to build a system around striking such that it doesn't numb our health workers, and also it's effective on the part of the people, because the people feel that once you don't shut down it completely, the government will not listen to you. So I think that's why, so nobody's against striking. Striking is important, but it's just that there's got to be some kind of a system around it. But thank you very much, Bolaji.
Three YouTube comments I'll take in support. So, Call Michael says, if you are under a union and that you're subject to, that means that you're subject to the rules and regulations of the union, she should have been loyal to the nursing union. They are fighting for the betterment of healthcare. Akpofure says, it's a pity that emotions are high about the woman, but the truth is that if things are not done the way that we won't have what we need to take care of patients, so the strike is a must and needs 100%. Bobby says, ladies, in every democratic country, doctors, nurses go on strike. as we speak in the UK, junior doctors are on strike. For your information, Nigeria is one of the lowest paying countries for doctors and nurses in Africa.
Okay, any other comments? I think we can wrap up on this. We can have a call, the final call this morning. Harrison, thanks for calling. You're live. Good morning, Harrison.
Good morning.
Good morning, sir. You're live. Go ahead, please.
Hello, good morning.
Good morning. You're live. Go ahead, please.
Okay, thank you very much. I really appreciate what you guys are doing.
Thank you.
First, let me go back a little bit about the cyberbullying last week. I tried to phone in. This is my first time calling in.
Welcome to the show.
Yeah. You guys are the most beautiful ladies I've seen in Nigeria, and I love what you guys are doing.
Nice. Thank you.
You
We appreciate. We are blushing. Thank you.
Thank you. Thank God that for that nurse. But I want to say that Nigerian government should please listen to the nurses. They should not allow people to go on strike before they listen to them. Immediately the plan is ongoing, the government should call them and, discuss with them, not until they go on strike, before they call them for discussion. So please, they should do something about it.
Right.
But for the lady, I really appreciate what she's doing.
Yeah.
May the
Thank
good
you.
Lord continue to bless her.
Thank you very much, Harrison. I think that's all we can take on this. But in a nutshell, strike is something that we need to do. But Nigerian government, at the end of the day, is a system breakdown. The fact that there's no proper system to ensure that the nurses and the doctors and the healthcare workers are well taken care of. Because the truth is that nobody should have to come with those choices of actually rejecting a patient versus being complying with the strike action. It's a very difficult position for any human being to be. And as a government, we shouldn't allow that to happen. That's all we can take on this segment. When we come back, we continue with the next segment. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.